Hi, welcome to Wisconsin Doctors. I'm Justin Riley, and we are on location at Upland Hills Health in Dodgeville. And what an exciting time of year it is, because this is National Nutrition Month. And so we're really excited because we're going to be talking about healthy eating and exercise today. And what a great time right now to get outside and do some exercise. But first, we're going to be talking with Dr. Aaron Dunn about weight loss drugs and supplements. Dr. Dunn, welcome to the program.
Thank you.
So good to have you here. So, we've all seen commercials about diet pills, and I won't name any in particular, but can you tell us, what are some of the latest diet pills that are out there, and are they effective and safe?
Mm-hmm. Well, a lot of us have patients that come in and are interested in losing weight. They've tried several things and have been unsuccessful. And a lot of times they are asking about, is there any pill out there that can help me, right? So there are a handful of pills out there. Most of them are available by prescription. And basically most of the drugs that are FDA approved for weight loss use drugs that we use for other things and try to take advantage of their side effects to promote weight loss. For example, they'll use certain antidepressants, certain anti-seizure medications, some diabetic medications that have been shown to have some side effects of weight loss, decreased appetite, nausea, things like that, and trying to use those side effects to an advantage to get people to not eat as much, and you get indirect weight loss from that. So there's a lot of prescription drugs that are new on the market that are being heavily promoted for those reasons. We don't typically see them that much or use them that much for a couple reasons. Number one, they're new, so their side effect profile is yet to be really proven significantly, and a lot of the issue is cost. They're just really expensive. I'd like to talk specifically about maybe the most popular drugs. The one by prescription is a stimulant called phentermine, and then the other medication, which is available by prescription or over the counter, is the orlistat, which is available by prescription, and then the half dose is available over the counter called Ally. Now the phentermine is a stimulant, so it revs up the metabolism, tries to get your body to burn more calories.
Sure.
And so in the short term, it can be somewhat effective to promote some initial weight loss. Long term, we typically don't recommend it because when you take a stimulant long term, it can cause damage on the heart, cause bad heart rhythms, it can interfere with sleep, it can cause high blood pressure, and we try to avoid doing more harm with weight loss medications. So maybe in the short term, something like phentermine may be helpful, and you should certainly consult your doctor before doing that. The other medication is the orlistat, which you can get over the counter or by prescription. That basically keeps your body from absorbing fat in your food. So it makes your body waste more fat instead of absorbing it. So if you eat high fatty meals, you'll maybe absorb less fat, and that can sometimes cause some minor weight loss. There are some side effects, however. When you have a lot of fat in your stool, it can be really greasy, loose, and some people have incontinence trouble with bad diarrhea, and it gets worse the fattier foods you eat, the more problems you have. So plus, when you take that long term, you can have trouble absorbing certain important vitamins that come with the absorption of fat, especially like vitamin D is a popular vitamin that's very helpful for people's health for multiple reasons. And people can become vitamin D deficient if they lose that through their stool by not absorbing enough fat.
Absolutely.
So,
go ahead.
Yeah, so bottom line, diet pills are not the end-all be-all. There may be some short-term benefit with some drugs, but the bottom line is once you stop the medication, if you haven't changed your dietary habits and haven't started exercising to burn calories for the long term, you're going to gain the weight back. So anytime I start a patient on a diet pill, which is not very often, but when I do, I make sure that they take it in conjunction with adhering to a low-calorie, healthy diet and daily aerobic exercise, so that once the diet pill completes its course, then they can sustain the weight loss for the long term.
Absolutely. Well, Dr. Dunn, thank you so much for the information. And next we'll be talking with Dr. Sarah Fox. Don't go away. It's more Wisconsin Doctors coming up right here on CW57. Welcome back to Wisconsin Doctors. We're here at Upland Hills Health in Dodgeville, Wisconsin, and it's National Nutrition Month, so we'll be talking about healthy eating and exercise. And my next guest is Dr. Sarah Fox. Thank you so much for joining us today. Good to have you back. This is your second time on Wisconsin
That's
Doctors.
Right.
Well, welcome back. Good to see a familiar face. So I'm really excited because you've got this book that you wrote, and I'd love to just hear a little bit more about it. Tell us about it.
So the book is Super Snacks for Super Kids. It's a book of healthy recipes for snack ideas for parents to serve their children. And we wrote it, my co-author and I, Julie Stevenson, wrote it about 2.5 years ago. And we really wanted to write a book that was helpful for parents to get some ideas for how they could get their kids to eat a little bit healthier. My main motivation was my oldest daughter was being served some snacks in school that were really unhealthy, and I think it was partly because parents really didn't know what to serve their kids or what some healthy options would be for their kids. So we wanted to make the recipes really kid-friendly and also very simple so that it wasn't really difficult for parents to serve their kids the healthy foods that they needed.
Absolutely, and what I'm liking about this is I read through it a little bit is that it really is just snacks. It's not extravagant meals. These are really easy things to cook.
Very easy, very simple, and very quick, and don't require a lot of ingredients, don't require a lot of preparation.
Absolutely. And then Aaron, you had a question as well.
Yeah, I mean, there's some really good snacks in there, but sometimes I have a hard time explaining to my parents how to get the kids to eat healthy.
Yep.
What are some tips and tricks that you have found helpful?
Yeah, so one of the most important things is to really start very early with the kids, so starting actually in infancy, exposing them to a wide variety of fruits and vegetables and really giving them those different textures and flavors. It makes them a little bit more open to trying things down the road. And then having an expectation that the snacks are going to be healthy, so really having a rule. For example, in my house we use the rule snacks or fruits and vegetables. So if kids are looking for a snack after school, I can just say snacks or fruits and vegetables, and they go to the fridge and they grab something. And really not giving them the option of having something as a treat. We've really kind of gotten into the habit of having treats a lot of the time instead of snacks, and so really changing the conversation a little bit and having that high expectation for those healthy foods. And then also giving a wide variety of choices and letting kids choose. I mean, a lot of times they're given the option. If kids don't really like what you're having for dinner, they might make a peanut butter and jelly sandwich or make a grilled cheese or something like that. And really, that doesn't promote those healthy choices. That doesn't really promote them learning how to choose the healthy foods in the long run.
Tell me more about that. I got 3 girls at home, and sometimes we have that exact problem at the dinner table or at any mealtime with pickiness and not wanting what's served for supper or for whatever meal. How do you get picky eaters to expand their horizons?
So it's really common for kids to go through a picky stage. It usually starts around maybe 18 months and usually lasts till around 5, and then kids start to grow out of it quite a bit. And so if you give them a wide variety of options during that time and really make that the expectation and not give those other alternatives, then they will learn over time to eat those foods. But parents have to start to be comfortable with kids may choose not to eat at all if they're not happy with the choices that are on the mealtime, and that's okay. So it's okay for them to not eat much at dinner, and they'll make up for it in other meals. So we actually have a rule at our house. My son is a little bit picky, and so we have a rule: the next meal is breakfast. So if you don't like what we're having for dinner, we always make sure there's a wide variety of foods and at least one thing on the table that he likes. But the next meal is breakfast, and just understand that this is going to be what you have until the next meal. And he actually caught on to that pretty quickly and makes the choice whether he wants to eat something and how much he wants to eat it, whether he wants to try it. It doesn't really help to force kids into trying new things. That actually can rev up their adrenaline a little bit, which that adrenaline tastes a little bitter in their mouth, so any new flavor that they're tasting then they associate with that bitter flavor, and they're less likely to try it down the road. So really just making it a very relaxed environment with lots of good choices.
Absolutely, some great information there. We just have a few seconds left, but tell viewers how they can find out more about your book.
So they can check out our website, which is superkidsbook.com, and the book is available in the Madison area at the UW Hospital gift shop, and it's also available on our website.
Excellent. Well, Dr. Sarah Fox, thank you so much for coming on. This is really great material, so thank you so much.
Thank you.
Don't go away. There's more Wisconsin Doctors coming up right after this. Stay tuned. Welcome to Wisconsin Doctors. Welcome back to Wisconsin Doctors, I should say. And we're here at Upland Hills Health in Dodgeville, Wisconsin. And I'm really honored to be in the midst of the registered dietitian nutritionist team. So thanks for having me here, I should say. And first, we're going to be talking with Laura Isaacson. Laura, welcome to the program.
Thank you.
Good to have you here. It's Nutrition Month, and so it's time to start thinking about healthy lifestyles and doing things that are good for our bodies and minds. So talk to us a little bit about heart-healthy diets. What are some things that people can do if they want to maintain a good level of heart health? What can they eat?
When people talk to me about following a heart-healthy diet, I usually recommend that they follow the Mediterranean diet. This is a diet that incorporates a lot of fruits and vegetables. It's modeled after how people in the Mediterranean region of the world generally eat. People in that part of the world have a lower incidence of heart disease, and so I generally talk to them about following the Mediterranean diet.
Absolutely. So that's something that we'd all be excited to hear a little bit more about. Jaimee, you had a question as well.
Yeah, so we hear a lot about the Mediterranean diet, and a lot of my patients ask me about it, but what are some of the health benefits of this diet?
Well, the Mediterranean diet has been shown to help promote heart health, so lowering cholesterol and triglycerides, lowering the incidence of stroke. It has also been shown to lower the incidence of some types of cancers and even other diseases such as Alzheimer's and Parkinson's disease. This diet is high in fruits and vegetables. It also incorporates whole grains and healthy fats that come from nuts, olive oil, and fish. And so it's really more of a plant-based diet, and it focuses on less red meat, where you would probably consume red meat only once or twice a month, and more lean proteins like fish, which is high in omega-3 fatty acids, which helps to reduce your triglycerides and helps to reduce inflammation, and also some other plant proteins such as legumes.
Awesome. And then Susan, you had a question as well.
Laura, oftentimes my patients hear a lot about healthy fats, but they're not sure which fats are the healthy fats. So which fats are recommended for heart health?
Well, there are different types of fat. Sometimes people think that fat in your diet is bad, and that's not necessarily true. It's important to look at the type of fat that you're eating. And so we recommend that people consume less saturated fat, which comes from animal products such as meat and dairy and butter, and also less trans fats, which come from margarine and processed foods. And we would say that people should have more unsaturated fats, which come from plant products. Saturated fats are solid at room temperature. Unsaturated fats are liquid at room temperature. So olive oil and canola oil are types of unsaturated fats. Also, nuts have healthy unsaturated fats. And then, as I said earlier, fish has a different type of fat called omega-3 fatty acids, which have shown to be protective for heart and help with cholesterol levels.
Awesome. And trans fat, that sounds like it's something, I mean, what are some examples of some foods that trans fat is? And you mentioned margarine.
It's in margarine and it's in a lot of processed foods. So really you should try to avoid eating processed foods. On the food label you will look and it will say partially hydrogenated oil. That means it's a trans fat. Trans fat is also on the food label. So definitely look at the food labels, and really you're going to want to have more fresh fruits and vegetables and whole grains.
Awesome. Laura Isaacson, great information. Thank you so much for joining us today.
Thank you.
When we come back, we're going to be talking more nutrition here on Wisconsin Doctors. Don't go away. Welcome back to Wisconsin Doctors. We're here at Upland Hills Health in Dodgeville, Wisconsin, and we are smack dab in the middle of National Nutrition Month here, aren't we? And I'm smack dab in the middle of our dietitian and nutritionist team here at Upland Hills Health. And next we'll be talking with Jaimee Jordan. Welcome to the program.
Thanks for having me.
Yeah, so good to have you here. We're going to be talking with you a little bit about a more serious topic, diabetes. And can you tell us a little bit about what diabetes is, and if somebody has it and maybe doesn't know they have it, what are some of the symptoms they can look for?
Sure. Well, basically diabetes is a condition where somebody's sugar in their blood is too high. So for any of us, when we eat, carbohydrates and the sugar that we eat turn into sugar in our bloodstream. And what's supposed to happen is our pancreas makes insulin, and it attaches to our cells in our body to let that sugar in to get used for energy. But what happens with people with diabetes is their bodies aren't making enough insulin, or it's just not using it as well as it had in the past. So what can happen is your sugar can get high over time and lead to lots of complications. There's a couple different types of diabetes. There's type 1, type 2, and gestational diabetes in pregnancy. But some of the symptoms to look for would be if you're going to the bathroom a lot, if you're drinking a lot of water and you feel like you can't quench your thirst. Even if you have like a cut or sore that won't heal, those are some classic symptoms of diabetes. So if you have any of those symptoms, it's really important to get to your doctor and get checked out just to make sure that we get it under control.
Right,
so,
right. And it might not even be diabetes, it could be something else.
Exactly.
So either way.
Might as well go get it checked out
Yeah.
and find out. So.
Absolutely. Laura, you had a question.
Sure. We have people that are diagnosed with diabetes that we see, and they may not be able to get in right away to see you to have a consultation. So do you have any tips for those patients about things that they can do to help control their diabetes until they get in to see you?
Yeah, one of the most important things is just to be eating regular meals during the day, breakfast, lunch, and dinner, maybe a couple snacks if you go a long time without having anything to eat. And then really trying to drink a lot of water instead of some of those sugar-sweetened beverages or things like Gatorade or soda. That's really important too. And the other thing is exercise. So if you're not doing any exercise now, walking is one of the most important things that you can do, and it's one of the easiest things. So even if you're not getting any right now, a couple days a week, and now that the weather is starting to warm up, that's always a little bit easier to get into. So
Absolutely. Get outside, folks, while you can. Susan, you had a question.
So we have tons of different patients here, and some of them prefer individual consultations, but are there other options or programs for people with diabetes or pre-diabetes here at Upland Hills?
yes, like you said, we have the individual consultations for medical nutrition therapy and then the diabetes self-management training as well. But we do offer group classes, which is really great because people can come in, share ideas, bounce ideas back and forth off of each other, and it really helps the learning process. And the other program that we've recently started is Healthy Living with Diabetes. So this is with the Aging and Disability Resource Center here in Dodgeville, and it's sponsored through the Wisconsin Institute of Healthy Aging. It's a 6-week program, and each class is about 2.5 hours. Kind of the same thing. We talk about a lot of different things, blood sugar monitoring, healthy eating. So those are some of the programs that we offer here right now at Upland Hills.
And those are some, there's a way for people to get, it sounds like a way for people to get support, extra support in healthy eating in that regard. So,
Yes,
yeah,
yep.
yeah.
Mhm.
Well, Jaimee Jordan, thank you so much for the information today. It was good talking with you.
Thank you.
Don't go away. We have one more person to talk with, Susan, in just a moment. It's more Wisconsin Doctors right after this on CW 57. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, Wisconsin, and it's an exciting time because it is National Nutrition Month, and here to talk more about that is registered nutrition and dietitian nutritionist Susan Eberle. Welcome to the program.
Thank you.
So good to have you here. So talk to us a little bit about National Nutrition Month. What's involved?
So National Nutrition Month is a nutrition education and informational campaign that's supported by the Academy of Nutrition and Dietetics that occurs every year in the month of March.
Okay, very cool. And Laura, you had a question to follow up.
Yes, Susan, I was wondering if you could explain what this year's National Nutrition Month theme is.
Sure, so every year they come up with a theme to kind of help support the healthy lifestyle initiative. So this year our theme is Bite into a Healthy Lifestyle. And that's just meant to promote healthy eating and physical activity and to help promote people to maintain and achieve a healthy weight and just overall promoting a healthy lifestyle.
Yeah, absolutely. And Jaimee, you had a question as well.
Yeah, can you explain to the viewers what is a registered dietitian nutritionist and how can we help them?
Sure, so a registered dietitian nutritionist has a 4-year degree in dietetics and has completed a supervised internship and then passed a registration examination with the Academy of Nutrition and Dietetics. And that kind of helps make us the food and nutrition experts. So that's where we can kind of help out in different areas. We can provide personally tailored nutrition advice to help people achieve and maintain that healthy weight, promote a healthy lifestyle, reduce your risk for chronic diseases.
Awesome. And do you have any specific activities that you guys as registered dietitian nutritionists are leading here at Upland Hills to promote National Nutrition Month? Do you have anything specifically that you're doing?
Right now what we're doing is we are featuring recipes in our cafeteria every day that the 3 of us have picked out, and the kitchen is working on making those for us. So that's kind of our big celebration, is everyone tries a new recipe every day.
Cool. And as far as any exercise, are you leading any walks or anything like that, or?
We have employee walks every day.
Sure.
Just to
that's
kind
a
of,
daily thing here.
Yeah.
Very
yep.
cool.
To
Tell
try-
us a little bit about that.
So every day at 10 a.m. we have 10 a.m. 10-minute walks, so everyone can use their 10-minute break to just kind of walk the hallways and get up and get moving. It's been shown that can help make people more productive. So
Absolutely. It kind of gets us out of that funk, that mental funk that we might be in after a few hours of sitting at a desk.
Yep.
So,
Yep.
yes. Well, Susan Eberle, thank you so much for the information today. It was nice talking with you.
thank you.
And my other 2 guests were Laura Isaacson and Jaimee Jordan, all 3 registered dietitian nutritionists here at Upland Hills Health. That's all the time we have for Wisconsin Doctors today. From all of us here at Wisconsin Doctors and CW57, we're inviting you to live longer, live better. We'll see you next time.